Hello, my name's Melanie Robertson. I'm Assistant Director of Nursing at South Tyneside and Sunderland NHS Foundation Trust. I have the role of lead clinician for cancer and I work clinically in oncology with patients with breast cancer. I'd like to talk to you about the term MDT that some of you cancer specialists might refer to, just to explain a little bit about what that actually is. So MDT stands for multidisciplinary team, and your cancer specialists may talk about discussing your case at the MDT, and actually what they're referring to then is the team meeting that the multidisciplinary team have, where they come together on a weekly basis to discuss patient cases to help with the diagnosis of cancer and make sure that your pathway is as smooth as possible. So the team consists of your lead consultant, so be that a physician or a surgeon, and the clinical nurse specialists, and then a whole range of other support clinicians that are working behind the scenes to make sure we get everything right for you, such as the radiologist, who is an expert in x-rays and other forms of diagnostic tests, the histopathologist, who looks at tissues under a microscope and offers us some advice about exactly what sort of cancer this is, or if this is just benign tissue that we see in. We have the oncologist, who specialises in treating cancer with radiotherapy, chemotherapy and other treatments. And along with the specialist nurses, we have other members of the team who are there to help support, such as the allied health professionals like the dietitian and the speech and language therapist who may be part of that MDT. The meeting is planned by an MDT coordinator who, at the request of a member of the team, organises for a patient's case to be discussed. They organise all of the information and details and keep the records clear so we know what the recommendations of that meeting are. The purpose of the MDT is to support the clinical team to help us make that diagnosis and offer suggestions for treatment that might be right for you. It's really important to say that the MDTs are not making a decision about you without you being there. They're simply reviewing all of the evidence that they have and making recommendations for what the best options moving forward are, and there may be a number of best options for you. Your lead clinician will then bring that information back to you and tell you what your options are, and between you and that lead clinician, with the support of your clinical nurse specialist, you will determine what's right for you and what the way forward is. So each of the MDTs work very differently. So within this trust, colorectal and lung have their own MDT here in the trust, just for South Tyneside and Sunderland patients. And there are other MDTs that work more in conjunction with other hospitals in the area. So for instance, the urology and the haematology MDT based here at South Tyneside and Sunderland also discuss patients from other hospitals such as Durham or Gateshead. And in other cancer types, for instance breast and gynecology, members of our clinical staff here would visit Gateshead Hospital to attend the MDT there, so that we get that real expert opinion for you. If you want any more information or have any thoughts regarding this, please discuss them with your clinical nurse specialist or another member of the clinical team, or check out our website.